I am Dr. Charlene Robel Lokay Ramos, the Executive Assistant to the Dean, School of Medicine of University of Perpetual Health System, Dalta.
I'm Dr. Karla Motal-Malyari, the Vice Chairman of Obstetrics and Gynecology.
University of Perpetual Health System, Dalta.
The Philippines is a tropical country located in the Southeast Asia region. The medium of communication is English. The cost of living is almost at par in India. The Philippines' medical education follows the American standard of health education. So to speak, the University of Perpetual Health System, Dalta, in Manila, Philippines, follows the same standard of education, which is an accredited body, a higher education institution by Commission of Higher Education in the Philippines. It is also an ISO certified institution that has been existent for the past 45 years. The university has an autonomous status. This autonomous status is only given to a long tradition of integrity, with untarnished reputation, with commitment to excellence, and viability and sustainability of operations.
The University of Perpetual Health System, Dalta, School of Medicine is a center of excellence in medical education, training, research, and community service. So our goal is to produce competent and quality physicians.
Once you enter our medical program, you have to first clear the pre-medicine program, which is a bachelor's degree program. After that, you will enter our medicine, which is a 4-year curriculum base, and our curriculum is outcome-based education, which is now the standard for American education. Our first year, you will encompass the basic sciences, which is composed of gross anatomy, histology, neuroanatomy, physiology, biochemistry, preventive medicine, and community health services. Those subjects will first introduced to you as a first-year medical student. As a freshman, we will also offer a unique course, which is what we call pedagogy. This pedagogy will be offered to freshmen just to give them an abrupt idea on how to learn medicine. This is what we give them, how to teach and approach learning strategies. Once you come into second year, the second year subjects have basic sciences as well as clinical sciences. During this time, the student will be given courses like case studies. They will be introduced on how to diagnose diseases, history taking, physical examinations, as well as management. During this time, we assess the student by OSCE, or the Objective Structured Clinical Examination. Multiple choice questions will also be given, as well as laboratory works. During your second year, after you cleared all your second year subjects and your first year, you will now have the comprehensive examination. The comprehensive examination will then be a reflection of what have you learned for the past 2 years in medical school. After clearing that exam, which is only a 200 multiple choice questions, you will then enter your third year medical school. It will be purely clinical sciences, which will focus on the different branches of medicine. After clearing third year, you will have again another comprehensive examination just to reflect on what you have learned during your course. After the third year, you will then move on for your fourth year, or the Medical Clinical Clerkship Program. It is a 52 weeks clinical rotation on the different departments, which will then be given to you for you to have medical or clinical exposure to different patients.
Our medical school has a base hospital, a level 3 tertiary hospital, which has an accredited residency training programs in different specialties like internal medicine, pediatrics, surgery, and obstetrics and gynecology. So these departments will help them enhance their theoretical knowledge and practical skills. Once they go to the hospital, they will rotate in the different specialty departments where they will be enhanced to develop their theoretical knowledge and clinical skills. So we have 4 major departments such as internal medicine, pediatrics, surgery, and obstetrics and gynecology. These they will have to rotate for 8 weeks or 2 months. And then the minor departments are otolaryngology, ophthalmology, psychiatry, radiology, and anesthesia. These they will have to rotate for 2 weeks, except for the preventive medicine and community health, which they have to rotate for 4 weeks. So the role of the clinical clerk, during their rotations in the major departments, such as in medicine, they will be part of the healthcare team, provided that they will be supervised by an intern, a resident, or an attending physician. They will be given an opportunity to do minor procedures such as intravenous insertion, indwelling Foley catheter insertion, and nasogastric tube insertion. They can also assist in major procedures such as thoracentesis and paracentesis. So during these rotations, they have to go on duty for 24 hours, and on some days, they will be assigned in the outpatient department, emergency room, and intensive care unit. And also, during these rotations, they will be part of the grand rounds, case conferences, case discussions with the attending physicians, and all other discussions that could help enhance their theoretical knowledge and practical skills. One other major department is the obstetrics and gynecology, which is a product of its residency training in the Perpetual Health Medical Center. What we did for the residents and interns, so when the clerks rotate in that department, we taught them how to do normal spontaneous delivery. We asked them to assist in major operations like cesarean section and major operations like exploratory laparotomy. So during my visit here in India, I was able to meet my previous students from the Perpetual Health System School of Medicine. They already passed their MCI and PG exams. Some of them are now in residency training, and some of them are in their private practice, and some are working in the hospital. So this is actually a clear evidence that Perpetual Health is producing quality and competent physicians.
University of Perpetual Help System, Talta.